Hi, do you ever have any questions about your medications? Your doctors, nurses and pharmacists work hard to keep you healthy, but you are also responsible. In this video, you will learn how to find right information about your medicines. You will find out what question to ask the healthcare professional because it is your health and your life. Unfortunately, medication error do happen. They happen in the hospital, clinic, pharmacy and even your home. And sometimes people get hurt because of this error. The more information you have, the better you are able to prevent the errors and to take care of yourself. You have to ask your pharmacists, doctors and nurses about your medication and you have to expect answers from them. So check out this video that guide you through 6 simple ways on how to find the right information about your medicines.
Do you really know about your medicines? The side effect, the allergy, the drug interactions, the drug dose, the label of the medications, what, when, how to take, missed dose, and drug interactions. Number 1. Read the medication label on your medications. If more information is needed, you may read the medication boxes, bottles, or the product inserts inside your medication box.
Through your medication envelope, you may find your reliable sources of information in regards of your medications. First of all, you may find your healthcare institution details, your drug names, your identification that include your name and your registration number, the date the drug was dispensed to you, your instruction on how to take your medications, for example, 2 tablets 3 times a day, as well as the price of your drug.
There are 6 things you may want to read on the drug packaging label or product inserts. The active ingredients, where the ingredients in the medicines that make it work in your body to relieve your symptoms or to bring about the desired effect. The uses of the medication inform the symptoms or conditions that the medicine is approved to treat. The warning of the medications is the safety instructions for when and when not to take the medicines. Other informations that may included are the informations about how to store the medicines or other important facts about the medicines not presented elsewhere on the label. The inactive ingredients that include in the medicines that do not have an effect in your body but are used to make it and give it color. Other information that may available are some labels provided a telephone number in case you have questions about taking the medicine. Number 2. Ask your friendly pharmacist. You can always ask any pharmacist for further clarifications about your medications. You may ask your hospital pharmacist and even the nearest community pharmacist. Questions you may want to ask your pharmacist. What is the name of the medicines, the brand or the generic names? What is the medicine used for? How is it going to help me? When should I notice differences or improvement? Should I avoid any foods, drinks or other medicines while taking these medicines? What are the possible side effects and how do I prevent or manage them? What should I do if I miss a dose? How should I store the medicines? How? For example, by mouth or inhale, and when should I take these medicines? Where can I get written information about these medicines? Number 3. Finding reliable medicines information on the internet. Check website reliability and trustworthiness before following anything on a website. Ensure that it is safe. You can do this by checking the credibility of the website yourself or ask your friendly pharmacist for a reliable drug information website suggestions. You may go to www.knowyourmedicines.gov.my or even www.mpra.gov.my. The 6 criteria you may ask before you trust the website are: Number 1. The authority. The editorial team should consist of pharmacists and medical doctors. The team constantly review the material with a trusted resource medical publishing partner to ensure concise and updated information. Number 2, check the appearances. The website should stay true to their purpose, where the information can be digested and used by both public and healthcare professionals. The site should be well organized and has simple features to make it easy accessible by all visitors. Number 3, check the coverage. The material provided successfully addressing topics and presented enough evidence to support it with references and citations. Checks the currency, meaning all the editorial team should regularly review the web page content from different backgrounds to ensure the accurate content information disseminated to the public. The review article are marked with updated status on the top or bottom of each document. Check the objectivity of the website. The content will not have any bias when they have a disclaimer stated their policy on advertising on their website. Do check the accuracy. To achieve this, the content supports the intention of using reliable sources for their information and led by credible pharmacists and medical doctors. Most interestingly, number 4, you can always head on to this website and send in your questions. This website is managed by Ministry of Health of Malaysia. The question that you key in with all your informations and your questions will be forwarded to the respective pharmacies to reply with an answer to your burning questions. Number 5, get the information from official social media. Always check the info you receive from the official social media owned by Ministry of Health or Duta Kenali Ubat Anda Facebook for more accurate informations.
But most of all, we are here for you. Number 6, you can always call us by reaching toll-free number of National Pharmacy Call Center at 1-800-886672 from 8 a.m. until 5 p.m. from Monday until Friday. National Pharmacy Call Center, or NPCC, is run by pharmacists from Ministry of Health with the aim for patients to have access to ask any questions about their medication from the pharmacists. NPCC informations come from using evidence-based practices with accurate resources for information such as textbook, medication databases, and reliable website. You may ask any type of questions you want in regards to your medications. For example, number 1, you want to ask drug indication or drug therapeutic function. You may forget or not know how to take your prescribed medication with certain type of drugs. Number 2, how to take your medication correctly. For example, when you have many types of drugs, you may want to know how to administer them accordingly. Number 3, the side effect or adverse effect. Side effects are unwanted symptoms caused by medical treatment. They are also called adverse effect or adverse reactions. All medicine can cause side effects, particularly if you don't use it correctly. If the situation is serious, you want to head on to the nearest hospital as soon as possible. Drug interactions may occur between drug to drug, drug to supplement, drug to food, and even drug to disease. These interactions may reduce the efficacy of your drug or causes serious effects. Finding the right information about your medication may be overwhelming. However, you can get reliable health information from your doctor, pharmacist, and community health center. But do beware of medical information provided by organizations trying to sell a particular product or services. Do remember that some online health information is reliable, but make sure to check who is providing the information and what they do to make sure it is accurate. And always take notes that information on Facebook, online forum, and chat rooms are not necessarily reliable. Always ask what is the medicines for. For each medicine you take, there's something different. So before you start any new medicines, it is wise to ask questions to help you to know what it is for and why you are taking it and how it will fit into your life. Having the right information put you in a better position to carefully weigh the benefit and risk of different medicines. And also remember that being medicine-wise using reliable sources of information because Dr. Google isn't really a doctor. you need to know where to find a trustworthy medicine information to be medicine-wise.